Climate change isn't just harmful to the environment, it's also bad for your personal health. The long-term damage left behind following recent hurricanes, floods, wildfires, and other climate change-related weather are taking their toll on our physical and mental well-being. Joining us this morning live from Edmonton is Professor Shirley Harper, University of Alberta professor and the head of the Climate Change and Health Hub. Welcome to your morning.
Good morning.
This is a fascinating study and some data to me. So Canadians are seeing the effects of climate change more every year. On average, we had the worst air quality in North America last year, including having 13 of the most polluted cities on the continent, and that's because of those record-breaking wildfires. So what do you and your colleagues at the Climate Change and Health Hub want Canadians to know about our personal health? Educate us here. What's it doing?
Well, really, we want people to think about climate change as a health issue. When people think about climate change, they often think about those wildfires, about extreme heat. They think about gradually increasing temperature. They think about it as an environmental problem. But what we also know is that it's a health problem. So if you think back to last summer, calling in from Edmonton here, we saw so many wildfires and the air quality was just terrible. And that, of course, that impacts our physical health, especially for people who have underlying respiratory conditions. But really, it's bad for everyone's lungs, so it's bad for lung health in general. But it's also really bad for our mental health. So if you're one of those communities that has to be evacuated from one of those wildfire areas, obviously that's incredibly stressful. And we have research showing that that increases things like anxiety, PTSD, depression, and other mental health outcomes. But we also know that it impacts the mental health of people who even aren't being evacuated. So if you're scrolling through social media and you see these images of people being evacuated and this, devastation, that's obviously very stressful too. And it's also stressful to see your friends and family go through that. And I could say that even for myself, being in Edmonton, not being able to get outside all summer, followed by, a long, dark winter, it's impactful even if you're not in one of the communities that's directly impacted, but you're impacted indirectly through the smoke. So it impacts our physical health, but also our mental health as well.
Yeah, when you lay it out like that, it all makes a lot of sense, right? The dots all connect. I'm wondering about the long-term effects. So when we look at damage from floods or from fires, we can see that it can take years for that to repair itself. What about the effects on our personal and our mental well-being?
Yeah, so there's impacts on our physical health and mental health long after those events. So on the example of mental health and flooding, for example, there's research that shows that those impacts on mental health can persist for years after the flood. And that makes a lot of sense too. If you think about it, having to deal with insurance companies and file claims or not having enough insurance, all of those things are really stressful. And there's research showing that impacts even years after the event. And it also impacts, children years after the event too. So things like test scores in schools, cognitive ability, all of these things we know have long-term events even after that flood or after that wildfire.
Here's something that we don't think a lot about, but we should start. How are warming temperatures and other elements of climate change affecting rates of diseases like malaria and Lyme disease?
Yeah, so malaria is something that people, used to think a lot about when they thought about climate change and health. They thought about things like malaria in faraway countries. And we know that climate change impacts malaria. But we also know that climate change impacts vector-borne diseases in Canada as well. So if you think about in Eastern Canada, Lyme disease or West Nile, we know that those are increasing and that there's a climate change link there. So, the environment is changing because of the warming temperatures. These ticks or mosquitoes are going to further north into new places where they weren't before. The season that they're active is longer, so our summers are active. That means that we have an increased risk of transmission. We have more exposure to those ticks and mosquitoes, and that increases our risk of disease. So, and that's even true in Western Canada. We're starting to see some things travel northward too, and some of the climate change projections into 2050 show that we could start to see some new vector-borne disease in Western Canada as well under high emission scenarios.
It's a fascinating branch of climate change and a discussion we don't have very often, but I imagine we'll be having more and more. Thanks for bringing us your research, Professor Harper.
Thank you.
Hey, thanks for watching. If you liked this, be sure to subscribe here, or you can check out more Your Morning videos right here.